what's the station? FY2?
Okay, so you are FY2. You said you want the cannula one, yeah?
I'm the cannula one. The patient
Okay.
is angry.
Yeah, so you FY2 in medicine ward, your colleagues, Alex, he didn't put the cannula. He's FY1 and you are FY2. So he didn't put the cannula for Mrs. Walker, who admitted with cellulitis 2 days ago. And Mrs. Walker is very angry. So please speak to your colleagues and discuss the matter with him.
I will need to speak to the colleague and I will
Yes.
discuss the matter with.
No, with colleague, always colleagues.
Okay.
They will never bring you two actors, so always will be one.
Okay. Okay. So I will be just talking to the colleague, talking to my colleague, isn't it?
Yes, about the cannula and Mrs. Walker very angry.
Okay.
Okay. All right. His name is Alex.
Begin.
Good morning. Do you? I think you know you. Are you Alex?
Yes, yes. Hi, Naeem. How are you?
Yeah. Yeah, I'm doing great. And how are you doing, Alex?
Yeah, I'm doing very good. Yeah.
Yeah.
Thanks.
How are the things? Okay. And how are the things going in your world?
Well, it's going good, but today it was very tough day. So I think I had lots of things to do.
Yes, I can understand that. It's a medicine department, and we have this a lot of patients, and sometimes we really it stresses us out, isn't it?
Yeah, it does.
Okay, so Alex, I know that you are an FY1, isn't it? And how are you enjoying your stay here?
Yeah, I'm fine. Yeah, they told you is everything fine. Yeah, apart from the load of work, which is too much for me.
Okay, so Alex, is it okay if we can talk in the doctor's room? Because it looks a little bit odd here. Just
Yeah, that's fine. We're already in the office. Yeah, doctor office. So no
okay,
problem.
okay, thank you, Alex. So Alex, do you know why I have come to talk to you?
No, you scared me now. Everything all right?
No, just you don't need to be scared, basically. The fact is that, there early in the morning, while I came, I heard that there was a patient in your ward, and she had this cellulitis. She was supposed to be cannulated, and it was you who had given the work to do the cannulation. So
Okay. Who's the patient? Which patient is
and
that?
she is one of the patients in the medicine department of the in the cellulitis ward. And yeah, what happened basically is that I think you might forgot to cannulate the patient, and that's why she is really uh, angry,
Can you
to be
tell me the
honest.
name of the patient? Just to remind me.
Uh, uh, Wait,
Is
let
it
me
Mrs.
check.
Walker? Mrs. Walker.
Yeah, yes. I think yes. She's something
Yeah, I
worker.
forgot. Yeah, I was about to put it, but my belief went on, and I went to do CPR, and that's why just I didn't do it.
Okay, so how was the patient doing? You told me that you had to go for the CPR.
Yeah,
How is she doing now?
the patient who did the resuscitation on them.
Yeah. You told me that
Yeah,
you
it was
didn't.
successful one. Yeah, it was successful. Yeah, that's good.
And what about her the patient you forgot to do the cannula? Did you talk to her?
No, I didn't get the counts. I just came back from the other ward. Yeah.
Okay, so Alex, I know that you are an FY2, and this it's been a couple of days. You are a newcomer here. So what I would suggest you, why don't you just go to the patient and talk to her, and then tell her that there is some issues, and you just apologize to. You can tell her that you're really sorry, and do the cannula.
Yes, yeah, I don't mind. I will go now, but you said she's angry, yeah?
Uh, yes, she is a little bit, or to be honest, angry. But I can assure you that I'll be there with you so that I can help you if there is anything wrong. Okay, Alex.
So you don't need to go with me, so I know you have lots of job to do, but I don't know how to deal with angry patient. Can you show me the steps how to deal with her?
Of course, I would love to show you I would love to help you in this regard, how to manage these angry patients. You know, when the patient is angry, and if it is logical, right, if there is some logical reasons, we are the doctors, we might do some mistakes and they get angry. What we do need to do, we need to understand their emotion. So, Alex, are you getting me?
Yes, understand their emotion. How? Like, I don't understand.
For example, when she is, you should go and you approach her to tell her the reasons why couldn't you do that. Then she may tell you so many things, but you should not react. You just let her tell those things, and after you will find that after expressing her emotions, then she will understand you, because they are our patients, and they are also human beings. They understand that we can there's something we do have sometimes we do mistakes, and if you apologize to a patient for that, and if you can understand her emotions, and if you let her emotions out, then she will consider that okay, it was done and now it can be managed. So
Two
and then
minutes,
you
two
can tell.
minutes remain. So, like you said, mistake. Did I do any mistake? Is it a mistake to
Oh,
do
oh,
the
well,
CPR?
well, it is not a mistake, but Alex, what was the issue? That if you can tell her that there is something more serious that had to be addressed at that moment, and it was a life-threatening condition for that other patient, whereas she wasn't having that issue, she will really understand that. So, are you getting me, Alex?
Yeah, but the patient might not understand. She will tell you, "I'm also important. I have cellulitis. What if it get worse by missing the antibiotic? What if I had
Yes,
sepsis
yes,
because of this?"
yes, yes, yes. Yeah. That's a valid concern. So, as it has been missed, there is the point to consider. For example, you could have told one of your colleagues at that time to look after her or do the cannula on behalf of you, and you could manage the or she could have switched you for the CPR resuscitation. So these things were to be done, but it wasn't done. That's why the patient is angry, and her concern is also valid. And so, what I would suggest you that you can go to her and apologize to her. And most importantly, this there has been an incident in the hospital, and somehow if the patient complains, that will be pretty much uncomfortable for you. So why don't you tell your senior regarding this issue? Then he
Okay.
will be able to help you out in this regard. So are you getting me?
Yeah, no problem. Yeah.
Okay, so this is all about everything. There is also an incident form, but I think it is not needed because this is just part of the procedure. So I think if the seniors are involved and if they know about these things, they will be help you out if there is any sort of an incidents or anything else. So is that how does that sound for you, Alex?
Yeah. All right. That's fine.
Okay, and I'm really sorry, and I think I know that we are in the medicine world is always something chaotic. So is it okay for you if we can have a cup of tea in the evening together? in the restaurant.
Okay, thanks for the offer.
Okay, thank you. And if there is any issues, you just tell me. I will be there to help you out through the procedure. Okay.
All right, that's fine. Thank you so much.
And okay, yes. And please don't stress yourself out because you are an FY1. You have come to this medicine department. You are a newcomer. I know this is really stressful for you, but look for help whenever you need someone. You just call them, and they will help you out. They will make sure that that you have the best benefit out of them because that's why we're doctors, Alex.
All right, yeah, thanks.
Okay, thank you, Alex. See you. Bye. Is it okay? I've finished in time or not?
Yeah, just now you added a few sentences after I told you the time finished, but it's still on time because in the real exam, the conversation will be less than the one I'm giving you. No problem about time, but just few things. Overall is good, but like don't assume anything. Don't mention anything is not in the task. So like cellulitis word. I didn't say about she has cellulitis, but there is no such a cellulitis word. She has just bed in one bay with other medicine. So we are in the medicine ward. So uh, like you told him initially, I heard that you didn't put the cannula. So you didn't hear. You in the task he didn't put. I just tell him. So tell him just Mrs. Walker is very angry because you didn't put the cannula for her. And that's all. Like this is fact. It's not because you heard about it. Yeah. So just the language, the sentence you use, try to make it factual rather than yeah. And you also told him you are a couple of days covering here. So also you assume this information is not written in the task at all. So this
Okay.
is, yeah, this kind of things, it make the examiner very angry. If you brought anything from your head, it means you know previous script and you brought it here. How could you know he had these things? So always try to be just whenever it's written in the task and the doctor, the patient itself or the colleagues, whatever, telling you, don't bring something from your head at all. And yeah, same thing in the previous station. What you told me this perispeculum examination it is very long station, so we may need extra time. You told me in the beginning of the teaching station. So how did you know 8 minutes is not enough for teaching perispeculum examination? Have you ever do BLAB 2 before, or you know there is some station in BLAB 2 which is perispeculum and you tried, you practice this station and you find that 8 minutes is not enough for this station? So
Okay.
the idea is never ever show the examiner that you prepared for this BLAB 2. You know what the
Okay.
station.
Never show the examiner.
Yeah, never show them that you know you already know the stations. This is the thing that upset them to death because it's this BLAB 2, it meant to test your English. If you know the station and prepared your English beforehand, it means you ruined all the concept about BLAB 2 exam. That's why even if they find someone scripted in the exam, so they will try to change the scenario for them and see how they will do. If they went with the flow of the exam, still they will pass them. But if they insisted to follow the script and just continue asking set of questions, asking, and the patient saying something different, they will fail them very, very bad. Like they will be surprised why I get 0 and 1 in this criteria, and I really did a lot. I ask a lot, and it's all relevant question. Because you are off topic, the role player prepared to tell you something different concern, and you asking something else. Because you know the script and you believe this is the same station, so I have to ask this set of questions. So always go with the flow, yeah. And you going with me with the flow, that's good. But you always be cautious about not mentioning anything not written in the task or the patient didn't tell you about it.
Okay. So uh, how about my counseling things and ethical
Yeah,
issues,
so
for
let's,
example?
yeah, it's nice, like you talking in a friendly way, good tone with your colleagues. You're very nice to me as your colleagues, and you're very concerned about me, and you offered me support and cup of tea in the end. So this is good point. They will put you up point. They will give you more marks for this kind of things because it really matter. But also like as a general approach, so
Yeah.
you have this colleague station, you have to divide it into section as well. Like we have the issue itself, and I think you did it right by telling the colleague straight away about the things. So for you started initially about going to the office. Don't mention about this to the doctor. So you are in the colleague in the exam. You told you are in the medical department, whatever, and your colleague in the room sitting alone, so no problem to discuss it with him straight away. You don't need to move to other areas. So just save your time. Don't mention about going to other private area or
Okay.
whatever. Even like you need to break bad news, don't tell the patient, let's go to private room. Because obviously in the Blab 2 exam, you are and this patient, no one else. So you don't need to take the place. Just save your time, yeah. And you don't ask him, do you know what I want to discuss with you? Just straight away tell him, uh, do you know Mrs. Walker, the one with cellulitis? So it's written in the task outside. So you know Mrs. Walker, you know she has cellulitis, the lady with cellulitis. So she's really angry because you didn't put her cannula. Would you please go and put it for her? So we need in colleague station or this kind of station. So we need to discuss the issue, and then patient safety, like if like there is any problem, we have to fix it right now. We need to do it straight away. Like this cannula, we tell him, would you is it okay by you to go and do it straight away for her or not? And if there is medical error, so as you mentioned, we have to discuss it with senior, which you did that, and do incident report form. Okay, is the patient complained or not complained? We have to do discuss with senior and incident report form. And if the patient want to complain, we will guide them through PALS, the complaint organization. So
Okay.
this
If the patient,
want to complain, so we can guide them through PALS.
patient advisor and liaison service.
Yeah. If they want to complain, but if they didn't want to complain, we also need to write the incident report form. When you spoke about this incident report form, you went very fast and you told me something I couldn't get it even. So don't speak too fast. Even if the
Okay.
6-minute bell rang, relax. Don't, if you speak too fast and are your English ruined in the end of the station, will give bad impression. First and
Okay.
last impression make a huge difference in the mark, because the people who marking are human beings, so they always have some kind of judgment. So try always not to embrace from the beginning to the end. Just make sure that you are very good doctors with very good English, clear English, and you are ready to work here. So this is what I want.